Okay, next segment is to go through the major structures of the cat. And we're just going to go through the laboratory supplement list, starting with the thoracic cavity. The thoracic cavity is the cavity above the diaphragm. And within the thoracic cavity we have our subcavities. So we have a right pleural cavity around the right lung and a left pleural cavity around the left lung. Immediately around the heart is this sac called the mediastinum, and we're going to go ahead and cut that open to expose the pericardial cavity. So you just lift up on that mediastinum and make an incision in the sac over the heart. Okay, like that. So now the heart sits in its own cavity inside. Okay, pericardial cavity. We have some more of that goop in there. Okay, and then the abdominal and pelvic cavities are below the diaphragm. Now, some membranes. Remember that the parietal always lines the cavity wall. The visceral layer always lines the organ. And the rest of the name of the membrane is just the cavity name. So we're going to start with parietal pleura. That has to be on the wall of the thoracic cavity, parietal pleura. Visceral pleura is on the organ. So here's the lung on the other side. On the organ is the visceral pleura. Now we have the parietal pericardium and the visceral pericardium. So here's the heart. Okay, it's kind of got some of this goober stuff on there. Heart. On the heart will be visceral pericardium. Then, if you look closely and pay attention to what you're seeing in this cavity, you actually have two layers to what I'm holding. You have a really tough fibrous layer, and I can pull on it and it doesn't tear. And then this piece, or this layer, that comes easily away. This layer is the mediastinal pleura. The fibrous layer, this one, is the parietal pericardium. So you have three layers here. On the heart, visceral pericardium. Around the heart and fibrous, parietal pericardium. Then you have this single cell layer of serous membrane, and it's called the mediastinal pleura because it literally goes down this side wall, behind the lung, and back up to form the mediastinum. So it's pleural membrane forming the mediastinum, so they call it mediastinal pleura. Alright, then in the abdominal pelvic cavity, we have the peritoneal cavity. On the wall, parietal peritoneum. On the organs, visceral peritoneum. And then we have our few special membranes that are associated with the abdominal pelvic cavity, starting with the greater omentum. Now the greater omentum is stuck to the greater curvature of the stomach. Now this big brown thing is the liver, so you gently lift that back. And this giant pouch right here is the stomach. Okay, there it is. Now, along the greater curvature is this thing that looks like fat. But it's actually a membrane that can fill with fat. And if you gently unravel it, you might have to unravel it from around some intestines and things. I did that when I washed out the cat. Okay, this great big membrane is the greater omentum. And this is the one that is going to try to wrap itself in and around the organs, and if there's ever a puncture to the organs, it would seal that and help clot. Okay. The lesser omentum is between the liver and the stomach, and it's just this tiny bit of membrane in here between the stomach and the liver, right in here. Lesser omentum tethers those two organs together. Then we have mesentery. These are the small intestines, and if you just kind of gently unravel them and open them up, you can see that these membranous structures are holding that intestine to the back of the body wall, mesentery. Then you find the colon, which is along the back of the body wall here. And if you lift that up, you have mesocolon. You can see my finger behind there. Okay, and that's tethering the colon to the back of the body wall, mesocolon. Alright, major organs, I already showed you the heart, that's in there. Right and left lungs on either side of the heart. Right lung, left lungs. And then we have the liver, it's the large brown organ, and the stomach. The spleen is right next to the stomach, so it's on the left side, left quadrant. And it's this elongated brown organ, like this. It's a little bit longer than it is in humans. Humans were a little more oval. Cat spleen is long, but in the same position and serves the same function. Spleen. Small intestines, we showed you that. Large intestine, along the back of the body wall. Okay. And then we have some kidneys. We've got a right kidney, which is still covered by the peritoneal membrane. And we're going to open that up in the next dissection. And then, sorry, that was left kidney. Right kidney over here, which is a little bit hidden by the liver. Okay. Then we have urinary bladder. We showed you with cavities, and that's tethered to that muscular wall by the median umbilical ligament. Thyroid. Alright, so for thyroid dissection, you have to do a muscular dissection in the neck. I'm going to turn this guy this way. And what you're going to do is make gentle incisions along the muscle of the neck and then push the tissue away. If you make too deep of an incision the first time, you're going to cut right through the trachea and the larynx, and then you're going to lose some lab points. So you do light incisions and push the tissue away, see what you've got and how much deeper you need to go. Okay, light incision, push the tissue away. Now, this tube is what we're looking for. That's the trachea. It's a ribbed white tube. We want to get enough muscle off of that that we can readily see it, and then we'll find the thyroid. Light incision. You also don't want to go too deep in this area because those are going to have some vessels of the cardiovascular system you're going to be responsible for identifying later. Okay, now once I find that tube, I'm going to use my blunt dissector tool and just run the probe along that tube, and that cleans off the soft tissue. Okay. Now I'm going to start on the left side because the problem with the right side is that's where they make their incision to put paint into the head and limb area, and oftentimes that thyroid gets damaged over there. But on the left side, it's going to be right next to the trachea, and it's going to be an elongated brown glandular organ right there. Kind of use your probe as a hook, and it's shiny. Now you can tell the difference between this gland and the muscle because the muscle will look stringy because of its fibers and its fascicles. That's the thyroid gland. Okay. Now we can try finding it on the other side. Oftentimes it's also a little dried up too because it's been exposed because of that incision that they make. And it's exactly what I've got over here. I've kind of got a raisin looking damaged thyroid gland over here. Okay. Alright, so we've got a really nice one on the left. Please try to at least find that for your points. Okay. Thymus. Thymus is going to be right over the heart, under where the sternum was. Thymus. And depending on how old your cat is, you'll have more or less of it. This cat actually has quite a bit. This big glandular blob right here is thymus. Now you can tell if your cat's going to have a lot or a little bit of thymus because of how his teeth look. And if they're white and not broken, he's relatively young. If they're yellow with some plaque but not broken, they're about middle age. And if they're all broken and nasty and full of plaque and yellow and brown, you've got a geriatric cat. The older the cat, the less thymus you're going to have. The younger the cat, the more thymus you're going to have. So if you ended up with a cat that's old and you don't have much thymus, walk around the room. Go see other people's thymuses.